Hi, my name is Kevin Osei, and this is my data mining presentation for HAP780 at George Mason University. The article I chose to talk about is titled Predicting COVID Incidents with Data Mining. First off, what is data mining? It can be defined as the process of identifying patterns, trends, and other relevant information from large datasets. It has a wide array of applications such as sales and marketing, education, fraud detection, operational optimization, and of course, healthcare. There are various techniques used in data mining that are used to analyze data, such as classification analysis, clustering analysis, regression analysis, and association rules. As seen on the title of this presentation, predicting the incidence of COVID is a main objective, so it's important to know what incidence is as well as prevalence. Incidence can be defined as the number of individuals that develop a disease or encounter a health-related event within a certain time period, while prevalence can be defined as the total number of individuals in a population who have a disease or health condition within a certain time period, which is usually displayed as a percentage. In other words, incidence is the number of new cases, while prevalence is the number of cases that were already established. If you didn't already know, COVID has become a pretty big deal. First reported cases of the novel coronavirus, or COVID-19, came from Wuhan, China on December 8th, 2019. More cases quickly popped up, and by January 30th, 2020, the World Health Organization, or WHO, declared this virus to be an international public health concern and finally called the outbreak a pandemic on March 11th. By March 30th, 693,282 people had been infected. About 57% of those infected were in Europe, 20% in the Americas, 15% in the Western Pacific, 7% in the Eastern Mediterranean, and 0.5% in Southeast Asia and Africa. The article highlighted that the high prevalence of COVID-19 made it a new pandemic, and that predicting prevalence and incidence for both is vital for health professionals throughout the world in order to make decisions to combat the virus. The overall goal of the study was to predict the incidence of COVID-19 during a 2-week period. So in order to achieve this goal, COVID-19 datasets were obtained from Johns Hopkins University. They contain information on COVID-19 cases in 252 different geographic regions since January 22nd, 2020 to March 29th, and were updated daily. They contained 17,136 records in 4 variables: latitude, longitude, date, and records. In order to design the incidence pattern for each geographic region, the information was used on the region and its neighboring areas gathered 2 weeks before the designing. Then a model was developed to predict the incidence rate for the coming 2 weeks, March 30th to April 12th. The model was created using a least square boosting classification algorithm. The model presented with 3 incidence rate groups: less than 200 confirmed cases per day, between 200 and 1,000 confirmed cases per day, and above 1,000 confirmed cases per day. With this, they were able to find the mean absolute error for each group and when the model performed the best for that group. For regions with less than 200 cases per day, the model performed best with a mean absolute error of 4.71% in data for the last 1434 days. For regions with 200 to 1,000 cases per day, the model performed best with a mean absolute error of 8.5%, and with data from the last 14 to 20 days, and with respect to the 9 nearest neighboring areas. Lastly, regions above 1,000 confirmed cases per day performed the best with a mean absolute error of 6.13%, considering information of the last 14 to 17 days of the region and its 2 neighboring areas. The model predicted 1,134,018 new cases worldwide. Europe made up 60.64% of this, followed by America with 24.07% and Asia with 9.44%. Australia, Africa, and South America had the least number of new cases, with both Africa and South America around 2% and Australia at 1%. But comparing the forecast results with the actual values in this time period showed that the model predicted the number of globally confirmed cases of COVID-19 with high accuracy, with 98.45%. The best predicted continental incidence rates were found in South America and Asia with 18.15 and 21.04% error, and the worst cases were still in Africa and Australia with more than 80% errors. So in conclusion, this study found that the pattern of incidence of a region is influenced by the pattern of disease in recent days in the same region and the neighboring areas. This conclusion was officially found after the evaluation set was 82% accurate. While this is good to see, there are still limitations to this study that impacted the results. For example, inaccurate prediction in Africa could be contributed to not having enough information on the continent within the data sets. Even with this, the model can be run with different intervals and can be implemented for future data. So the overall goal of creating a model that could predict COVID-19 incidence for a 2-week interval was successful. And with that, that is the end of my presentation. Thank you for listening.